reason why I asked the question,
Just 1 second.
like I told you, remdesivir.
They cannot see me.
Prevent the initial. Is it spike protein? Does it interfere with the spike protein on the coronavirus?
Yeah, actually, the spike. So the lock and key mechanism is already altered.
Yeah, okay. Great. So that's clear to me. I understand this. Now my question, because I'm really ignorant in the rest of the virology field, what would happen if you treat and the virus already a portion of the virus or a titer of the virus has already entered the cell? So your cure would be only to prevent new viruses entering the cell, but does it do anything to the ones that have already entered the cell?
Okay, that's where the valid. No, I will answer that, doctor. In the validation, we have what we call selective toxicity, meaning this drug affects or attacks the virus itself as well as the infected cells. Whereas the normal cells, this technology is friendly. It does not affect the normal cells. It's only the virus and that's what we call the selective toxicity, where our validation stands.
Okay. So I think, do you have any questions on Dwayne? No?
Yes, doctor?
Yeah.
Yeah.
Do you have any questions?
No.
Okay. Then, Dr. Fabunan and the team, I initially read your initial submission to our management, as I said. I think what we need from you now is just a simple proposal for the mechanism of action that you described for your drug to be submitted to us, and then we will go from there. We'll give our own comments to our management, and hopefully, if there is anything positive, you will hear from us soon. Okay?
Okay. Thank you very much.
Thank you. You have our email there, Rohan. You have
Yes,
our
doctor.
email?
Yes, I will coordinate with all of them.
So I just need a brief description of what Dr. Fabunan described earlier.
Now, viral diseases, we are so very acquainted with regards to the clinical aspect, the clinical side of the patient, okay? How you assess the patient. Another question I have immediately, does that include the standard care that has already been in place? I mean, if I am a COVID-19 patient, then should I stop what the hospital is giving me and just rely exclusively on your treatment? And I should be fine within 5 days of it. Is that your statement to make? In my opinion, because our technology can stand alone, meaning you can stop some of the other medicine for us to say that Fabunan antiviral injection is the sole medicine that can give the improvement with the patient. Okay? With regards to probably if the patient is confined and needs some oxygen
therapy, if you can continue those mechanical devices.
Great. So please include this in your summary, Rohan and Dr. FABUNAN. Include these things, the no side effects and the regimen of treatment, how many times you treat and the severity of the disease, so that we can have our own, and internal evaluation for the lab. Okay, sir?
Doctor,
Do you have any questions from us?
from your, yes, doctor. From your country, how do you assess the situation with regards to COVID?
Yes, there is several layers. Right now, for example, we're trying three clinical trials for a COVID-19 vaccine in conjunction with Sinopharm. We made this possible. And about 15,000 patients will be involved, 15,000 individuals will be enrolled in that program. That program would not have been in effect had it not been for a very well-established committee that looks at COVID-19 treatment and vaccine development and vaccine use. So there is a very well-formidable committee which is made up of several backgrounds of expertise from the field of either clinical medicine, clinical research, basic science. They are about 15 to 20 individuals. They look at the ins and outs of the actual procedure, actual components of the vaccine, and then they give their, scientific feedback to the higher management or to the decision makers. This is one layer. Another layer is already in our stockhouse, in the operating arm. They are carrying out clinical research of different products, and sometimes they come up with contradicting claims that the original company claims were made. For example, hydroxychloroquine is a very popular one. This has been stopped. And I think another, I forget which one, another drug was used and then has been stopped because simply it did not show any effectivity or efficacy in our patients. So our operating healthcare facilities do carry out individual and independent clinical trials, but yet through our major committee that I described earlier. And the final, final answer and decision is our healthcare leadership. When they are convinced of something, they will do it, and if they are not, they will not. So this is basically, the process. I hope I answered you, Dr.
Yes. But can I ask one more question, Doctor?
Yes.
Yeah. With regards to vaccine, how about infected patients? Do you agree that vaccine no longer be effective or useful with regards to patients who are infected with
Yes, I agree with you. Scientific statement, very logical statement. Usually the vaccine for prophylaxis, not necessarily for treatment, right? For things like, we were given the polio we didn't polio then, but alhamdulillah we got out. So
which are included in the trial. Are you aware actually the mechanism of action of those drugs?
The ones you mean in our phase 3 clinical trial?
Yes. Yeah. For example.
Yes. It's actually done through very, let's say, government operated conglomerate and consortium, and all the majority of people who are there, they are experts. One of them has been in our healthcare facility, and he moved up to become the advocate for this, and is the scientific merit of the phase 3 clinical trial drug itself, how inactivation has been installed or done, whether using UV light or other methodologies. All of these nitty-gritty details have been described very clearly and very, eloquently, so that even the decision makers or scientific people can read it and understand the ramification of the drug itself or of the vaccine. Yes, we have asked all these different detailed questions.
So comparatively, have you heard this FABUNAN.ABU injection?
The idea is from you today. Before it was just the one that you sent, the document that the PDF file that you sent to the management. I read that one, but I didn't understand the details. You described it very, very methodically, and I really appreciate that. Now I have a clear idea about what FABUNAN injection is. So I have an idea about it, and you justified why you use each component of it, which is what I need, and we'll go from there, inshallah. Okay.
Thank
And
you.
questions here?
Wow.
All satisfied, doctor? All angles satisfied?
Satisfied because I have met you, Seth, and met your team. This is the benefit of virtual meetings, because you get to meet people 10,000 miles away from you,
Yeah.
and you learn from them. Good.
Thank you, Dr. Rashid. Thank you for
Yes, sir.
time. Thank you, Amna. Thank you, Maita. Thank you, Dr. Fabunan. What I will do as the main coordinator of the entire group is I will work closely with Dr. Fabunan to get this summary of description that Dr. Rashid wants, and I will share with the team the science, the aspect, the treatment, the results, the administration, the laws. Yeah. We'll put a whole document together and we'll share it with your team, Amna.
Thank you.
Specifically, okay?
Yes, specifically Dr. Fabunan for COVID-19. This was only on COVID-19 for
Yes, exactly. This is the document that was shared with us.
Yes.
It says the cure COVID treatment. That's your document.
Yes, doctor. Yes, sir.
Yeah. So that's the only discussion we're having. We don't have any discussion of other treatment. The focus is on COVID-19.
Yeah, presently let's look at COVID-19, Dr. Fabunan. So the other can also be put into place once this is addressed, which is the main requirement.
Absolutely, sir. Absolutely. I agree with you. Thank you.
Thank you very much.
Any other questions?
No more questions, doctor. Again, sending our million thanks for accommodating us
Thank you, sir.
and giving our technology, presenting our technology to your beloved country.
Thank you, sir. When the flights are open, we will welcome you here if you want to stay at the visit. Okay?
Hopefully,
Okay.
doctor.
That is the next step, very much important, I guess.
Yeah.
Okay.
Thank you, sir. Thank you, Thank you, Dr. Fabunan.
Thank you, po. Thank you.
Thank you so much, everybody.
Thank you.
And
God bless you. And the Filipinos, they say in Tagalog, balik po kayo, right? Balik po kayo. Okay.
Yeah.
Okay.
The simple Tagalog Philippine doctor.
Yes.
I think the next meeting, Dr. Rashid is in Philippines.
We'll do it in Tagalog.
In your kingdom, okay? And our okay, thank you very much.
Have a great day, sir. Thank you. Salamat po.
Thank you. Salamat.
God bless. Bye.
Bye.
Done? Should I cut or do you want to continue?
Yeah. Okay.
Huh?
Doc, thank you. Okay na.
Done?
Ayan.